Welcome to Core Physio and Pilates video series. My name is Lee, and today we're going to be talking about pelvic girdle pain and giving you some advice to help with that pain. You've probably seen one of our physios already and you know about some of the advice that they're going to give you. But today we're going to reinforce some of these things to help you get as pain-free as possible during your pregnancy. So all women during pregnancy suffer some sort of pain somewhere, but the pelvic girdle pain can be felt in various different regions. And the reason we quite often have this pain is because of the release of hormones and the increased instability of our pelvis and joints around our lower back. Many women will feel it in the front of the pelvis in the pubic symphysis, and some will feel it in the lower back or in the sacroiliac joint. So no matter where you have your pain, this advice will really help you. The first bit of advice I'd like to give you is to ice any of your sore areas. Ice is a fantastic way to reduce the pain in these areas. So taking an ice pack, wrapping it in some wet paper towel or some wet cloth and placing it either in the front or on the back. A nice bit of advice if you have the pubic symphysis pain is to get some kind of condoms and pop some water in them and put them in the freezer, because they're a perfect shape just to put on top of that area in the front to really help. So daily icing is essential. The second bit of advice I'd like to give you is to avoid taking your legs too far apart or any single leg activity. So when you're getting in and out of the car, rather than stepping with your legs wide, sit yourself inside the car and then keep your legs together as if you're wearing a mini skirt and fling your legs inside the car. Similarly, when you get in and out of bed, rather than taking your legs nice and wide, keep them together, roll onto your side and then get out of bed. So really visualizing that you've got a mini skirt on and keeping the legs as close together. So similarly with walking, trying to avoid rushing or taking really big strides will really help to reduce your pain. Walking in general should be avoided if you have pelvic girdle pain. If you have pain in the front or back of the pelvis, some kind of compression garment is really useful to help reduce the pain. So we sell at Core the SRC pregnancy shorts, which we can measure you up for, and I find them a really helpful tool. We also have the sacroiliac joint belts by Ingrid Mitten, which are also fantastic if you have this pain. But see one of the physios and they can recommend what's best for you. Releasing the muscles around the hip and glute region is really helpful when you have pelvic girdle pain, because the muscles in the glutes tend to get quite tight. So if you have a spiky ball or a massage ball, refer to our spiky ball video, and there's some great exercises to release the muscles of the glutes. Or you can use maybe a hockey ball, but it does need to be quite a firm ball. Keeping strong in your pelvis and lower abdominal region when you're pregnant can really help prevent your pregnancy pains from getting worse, and also prevent the stability from getting any worse. So doing some stability exercises either at home, some pregnancy exercises, some Pilates exercises, or coming into class is really going to help keep you strong and prevent you from getting worse. So our pregnancy video is a great tool for you to focus on at home and do those exercises every day, if not more than once a day, to keep you strong. The pregnancy classes here at Core are very tailored to pregnancy, and we can tailor it if you have any pelvic girdle pain at all. So please make sure you keep on top of this pain. See a physio if your pain is not under control. We can tape you and do lots of physio techniques, which will really help. Don't just think that because it's there, it's going to be there forever. It does not have to be. So take our advice, and any questions, feel free to book in with the physio, and we'll see you in class soon. Thank you.